3 effective exercises to get rid of sciatica in the over 50s. If you're suffering with sciatica, it's affecting your life, you're frustrated, you can feel it when you're sitting and when you're moving, then this video is perfect for you. Hi, my name is Tommy Brennan. I'm the owner of the Pain and Performance Clinic based in Dublin. So sciatica is something that affects a huge amount of people. There are lots of causes for sciatica. It's not all to do with the disc issue coming from your back. One of the problems with this is that people get very fearful. They often go to health professionals and they're given some catastrophic information about discs, and that actually causes them to move less and move stiffer and move slower. And that actually becomes one of the things that contributes to sciatica becoming more of a problem in your life, especially if it's coming from a hip issue, because the symptoms will be the exact same. So what you need to start doing is, instead of protecting and avoiding the area, start moving a little bit more. A lot of people who suffer with sciatica say, I have it in my left hand side. They even develop habits like avoiding sitting on the area. So they're sitting over on this side and it causes lots of stiffness in the back, and it's actually not going to help your sciatica symptoms. If that pattern continues, as people walk around, they can actually be offloading that side again. All of these things promote fear and avoidance and worry and can increase the sensitivity in your leg. So it needs a different approach to that. What we're going to do now is go through 3 exercises that you can start doing at home yourself. These are safe and effective, and it's important to get some level of control back in this, rather than worrying about it and thinking someone is going to fix it and all that kind of thing. Of course, if you're worried, you need to check all that out with a doctor or with a therapist, but these are things that you can start doing to help yourself. Let's go through the first exercise here. Let's say it's on my left hand side. What I'm going to do is go close to a wall. You can have your hand there just to help with balance. I'm in this position, and instead of avoiding using this side, you're actually going to focus on using this leg more. You're going to do that by pushing down through your laces here. So stay relaxed, push down through your laces and drive your other knee up. Step back, push down through here. So everything is relaxed. You have to move, try and move a little bit freely, push through here, hold it up at the top for a second. I can feel some muscle activity here. Now, when you're doing that, just ask yourself, like, are you okay feeling muscle activity? Are you okay feeling symptoms in your leg? Try and stay relaxed. Pushing down through your left foot. How many you do depends on your conditioning and starting point, but get it to feel tired and fatigued. You can follow that up by just moving a little bit freer and a little bit looser. During all these exercises, it can be a little bit daunting trying to do something when you've been sore for so long. So try and stay relaxed and breathe throughout. You have to give it a go. Getting started can be one of the hardest things, but once you do that and you feel, I'm definitely no worse, that might give you encouragement to keep going. The second exercise is called a B stance sit to stand. So again, it's going away from the theme of protecting and avoiding the area, and actually the opposite, we're going to load it up. In this position here, if I get up from this position and I'm pushing more through this foot, I can feel this leg doing more work, which is what we want. So nice and relaxed, pushing down through the back foot here. Now you have to stay relaxed, you have to be okay with feeling some muscle activity. Say you do 10 and you're able for a little bit more. To make it a bit more advanced, stop with your hips 6 or 8 inches above the chair, breathe, relax, stay here. Just stay relaxed. Hold it, try and put all the weight through here, and then get back into it again. Again, try not to tense up, and as you're doing it here, this is quite a bit of work on this leg. If you do that and you actually experience what a lot of people can experience, is that reduction in symptoms. That can give you the confidence to do more, but you have to do it to experience that. The third exercise we're going to do then is a little bit more relaxed from that. You can follow that up with just a nice relaxed back bend. So breathe, try not to have any tension in your body, and you're just going to stretch. You can move around here, try and get a stretch through your back. And as long as that doesn't drastically increase your symptoms, then that's a good sign for you to do it. Do 15 or 20 nice and relaxed. Sit back in and you're good to go, or get up and go for a little walk and see how you feel. If you do this and you notice that there's an improvement in your symptoms, it will be a marker for you to continue doing it. This is not something that can cause any sort of damage, and one of the reasons that this sort of pain can be prolonged for a long time is that people have just no idea what to do with it, and they're stuck in fear and they avoid using that leg or that part of their body at all. So this is the opposite approach to that. If you're worried about back pain or red flags, we have other videos on the channel that you can look at and reference there. If you have any questions on any of these things, let me know. If it's sciatica from a true radicular pain issue, the duration of this is going to be difficult to take time off that, but you can either suffer badly or live your life with it. So doing something like this can modify symptoms and you can actually feel better. Maybe it comes back, but then you have a tool to use to help yourself again. Improving your lifestyle, sleep, a little bit of walking, a little bit of exercise, avoiding stress where possible. All of those healthier habits can also help with how you feel. Again, if you have any questions on anything to do with back pain or sciatica or any pain and injury, please feel free to comment below and we'll get back to you.